Thank you for that introduction, Robin, and hello to everyone joining today's event. So as Robin had mentioned, Cipher is the cybersecurity division of Prosegur, and we have over 20 years of experience delivering top-notch managed cybersecurity services to customers all over the world. And today we're proud to sponsor this panel along with AHIMA on cybersecurity considerations for the healthcare sector. So to kick things off, I'd like to first set the stage for this topic and then introduce our panelists. U.S. federal agencies recently warned that cyber criminals could unleash a wave of data scrambling extortion attempts against the U.S. healthcare system, and an effort that, if successful, could paralyze hospital information systems nationwide, just as the cases of COVID-19 are spiking. In a joint alert last month, the FBI and two federal agencies said they had credible information of an increase in imminent cybersecurity threat to U.S. hospitals and healthcare providers. So the alert said malicious groups are targeting the sector with attacks aiming for data theft and disruption of healthcare services. And you probably have also been hearing in the news about a large scale and sophisticated attack by a nation state who many suspect to be that of Russia. This attack was purportedly carried out against many government and private sector companies through a widely used network monitoring software system called SolarWinds. The attackers were purportedly able to infiltrate the SolarWinds network and implant malicious code inside legitimate SolarWare software updates. And this is an extremely effective but sophisticated supply chain attack. And many security experts have spent the last few nights awake and responding to and investigating if their organization is affected by this attack. And finally, in addition to these threats, we see sectors of the economy, to include healthcare, that are subject to what's called business email compromise. And according to the U.S. Federal Bureau of Investigation, business email compromise is carried out by transnational criminal organizations that employ lawyers, linguists, hackers, and social engineers. And since they started tracking this in October of 2013, the FBI reports that there have been over 26 billion US dollars in theft from this activity alone. And these are some incredible statistics. Luckily, our panel today comprises some of the top minds when it comes to cybersecurity and to how to protect your organization against the risk. So during the presentation here today, this is live. If you have any questions at all that you would like me to be able to have the panel review or answer, please go ahead and put those in the question and answer session of the Zoom session, and we'll go ahead and answer those for you. So let's take a few moments and introduce our panelists. First, I'd like to introduce Chris Apgar, who is the CEO and president of Apgar and Associates. Chris?
Hello, everybody. Welcome to today's webinar. I'm very happy to be here, and we have a great panel. We're looking forward to answering questions that I know are of interest to folks out there right now, especially with what Scott had indicated is occurring in the healthcare sector as well as in the government sector.
Yeah, thank you, Chris. Next, I'd like to introduce Teresa Massey, who is the cybersecurity advisor for Oregon at the U.S. Department of Homeland Security's Cybersecurity and Infrastructure Security Agency, also commonly known as CISA. Teresa?
Thank you, Scott. I know that's a mouthful. Delighted to be here. Look forward to chatting with you. Hope you have a lot of great questions. We have a super panel with experts that are going to share a lot of intel and experience with you. So from a CISA perspective, I'm delighted to be representing the Department of Homeland Security and CISA, and just chatting with you about some of the things that we have available and some guidance we might be able to share. Thank you.
Thank you, Teresa. Next on the list from our panel, we have Keith Fricke, who is the partner and principal consultant at TW Security. Keith?
Hello, everyone. Glad to be here. I think you're going to find that this is a very worthwhile hour out of your busy day. We have a lot of great information to share with you and some really good takeaways.
Great, thank you, Keith. And then last but not least is Stephen Fitton, who is the manager of information systems at Fairchild Health Medical Center. Stephen?
Good morning, good afternoon, I should say, for some of us. Thank you for this opportunity. And yeah, I look forward to sharing some thoughts and concerns and some solutions with everybody on the call today.
Thank you, Stephen. And also, in addition to the Q&A section as well, we have included a number of great references on cybersecurity in the healthcare sector on Cipher's website. They're currently posted at the bottom of the webpage where you registered for today's session. I've also asked our marketing director who's hosting this session, Bill Bowman, to also place that link in the Zoom chat session so that you can access these great resources. And now with that, let's start off with some questions. Let's start with, in general terms, what do you see out there in terms of cyber attacks? I think, Stephen, if you don't mind, would you be able to kick us off in terms of what you're observing?
So yeah, I mean, obviously, what we're dealing with is ever increasing levels of sophistication and nuance in the attacks. So these organizations, these bad actors, they do quite a bit of investigation into their targets. And so no longer is it, I mean, not to say that it doesn't happen, but you know, they really do hone in on specific organizations and even individuals within organizations to craft messages or attacks that really specifically target those individuals that they feel have the keys to the kingdom, or know the people who have the keys to the kingdom and are inadvertently going to give that information up.
And thanks, Stephen. That's from the healthcare, obviously, from your perspective there. Mm-hmm. And Teresa, from your perspective, sitting at the Department of Homeland Security and CISA, what are you seeing out there today?
Well, certainly we're seeing a lot of things that you mentioned. Hospitals are a prime target right now, which is so unfortunate because you are just swamped with dealing with COVID, and you've got the vaccine coming out, and it's just really unfortunate. But it is the healthcare is a top priority for CISA. We have a lot of programs and services that are available all at no charge, and really want folks to be as vigilant as they can. And I know when they're, many staff are working remotely, there's just a lot of challenges that they need to deal with. And but want you to know that the federal government is a very strong partner and wants to assist as much as we possibly can to help you through this.
Yeah, and Teresa, as you mentioned, kind of in the age of COVID, we've seen a work from home model adopted by a majority of businesses to include the healthcare sector, especially those that don't need to be physically on site to be able to conduct their work. So let's talk a little bit about that. So what are some of the specific types of attacks that we've seen that take advantage of significant shift to telework and telehealth? Chris, from your perspective, can you chime in there?
One of the things that we've seen following or about the same time as the FBI and Homeland Security announcement about the imminent threat to healthcare is we've seen a number of hospitals that have been hit with ransomware, one including in my state is Oregon. And what they, through the grapevine, what I heard in the one in Klamath Falls, Oregon, was that somebody was working from home. They had two browsers open. One of them was their Gmail account. The other one was their working, and they opened an email, a webmail, and that infected their computer, which in turn infected their network, which shut them down. And they ended up having to replace like 1,000 computers and so forth. So it was a very significant impact. And I'm seeing that that's a real risk out there. You not only have phishing email that's become rather sophisticated that people are receiving, and they don't necessarily think about it because it looks official, so they'll click on the link, or it looks like it's coming from within the organization when it's not. It's phishing, so they're sort of a false sense of security, and they click on it, and that is resulting in malicious attacks, including ransomware as well as other things.
Yeah, and then Keith, from your perspective as well, what have you seen from specific attacks against the shift to telework and telehealth, and what are your thoughts around how organizations could possibly protect themselves against these types of attacks?
Yeah, as Chris mentioned, with ransomware and in particular business email compromise, those are key areas to look out for. Specifically for business email compromise, as organizations have matured their security programs, they're doing things like putting a banner in email that's coming in that identifies that this message came from an external sender. So if the criminals are able to compromise a legitimate email account of a company's email system and use that to send other phishing messages from internal, there's no banner that gets stamped in those, and so people are more likely to interact with them. And some of the methods that the criminals are using have become pretty devious. I saw one phishing email where somebody had sent out this message. It was a targeted attack. They were purporting to be from a state mental health board. And what they did is they copied and pasted an image of a PDF and buried a link in it. And the instructions were, here's some new information from the state government you need to know about. If you click on the link and enter your email credentials, we can download this document for you. And so they're very crafty in how they're engineering these attacks. And that just underscores the importance of continuous training for the workforce.
Yeah, Keith, you mentioned training. I think when we spoke the other day, you talked about split tunneling as well, too, and some of the considerations around that. Would you be able to elaborate on that?
Yeah, that's something that Chris had just mentioned, where if you've got a browser open to an internet site, and then at the same time you've authenticated into your network, split tunneling allows those to exist simultaneously. So it's possible for a criminal to trick you into installing malware on your workstation, where they can come into it, take control of it, and then literally skate in on that VPN connection to the internal network. If you have split tunneling disabled, you can only be doing one or the other at a time.
Yeah, that makes sense. That's a good policy to put into place for organizations that are considering to continue their employees from working from home. Stephen, what about from your perspective then? What are some of the steps that organizations can take to help protect themselves against telework and telehealth attacks?
Well, as Keith alluded to, is training and training. It's really critical to give the information to employees so in a digestible manner format, so they can understand what's at risk and how they're being targeted. And I think we provide that information. I think that goes a tremendous way. We are dealing with a paradigm shift where a lot of people are working from home for the first time, and I think that people's guards are down. They don't understand that just because they're at home, they're not in a safe spot necessarily. So they're connected to the internet, and thereby they are there's no safety in that, quite frankly. So being constantly and ever vigilant, I think is key, and continuous tips to the employee base, updates of critical information in terms of emerging attacks. OCR publishes that mailing list, and I'm not saying we don't necessarily want to send that out, but what tidbits of information can we share to the employee base that they can keep their awareness up to date.
Absolutely. And we have some good questions that are coming in now that are very relevant to the topic that we're discussing. Marilyn Harris actually put one in here, so I'm going to kind of read it out to the panel here and open up to anyone on the panel to jump in and answer the question. But she says, what are your suggestions on getting more healthcare workers interested in healthcare cybersecurity? I'm a registered nurse that pivoted my career to healthcare cybersecurity 2 years ago.
I think go ahead, Keith.
I was going to say, jump in on that one quickly. I think one of the things that I have found to be very effective is you have to attach some kind of personal meaning to the training,
Right.
Because in healthcare, workers are inundated with all sorts of requirements for training across all sorts of different spectrums of topics. And information security and privacy is just one of them. If you can help explain to people that by not paying attention to the things that you're being asked to do related to security and privacy, you may be effective in preventing a breach. Breaches cost money, and that could affect your raise next year. So make it personal.
Yeah.
And the other thing I would say, as far as making it personal, is also, one of the things I found that's effective is it's making it even personal by saying, okay, hey, your financial information's on your phone, your pictures of your family is on your phone, and making it also personal outside of the workforce, because if they're more careful, especially with what Stephen had mentioned, is you've got this whole paradigm shift where more people are working at home. If they start to integrate that into their personal lives, at least the hopeful outcome is they will take greater care on your end. And to me, it's if you're going to have training, it needs to be ongoing, and it also needs to be dynamic. It doesn't mean you have to go sit in a class for a half an hour or an hour. I think Stephen mentioned security reminders and things like that. So it's you make it tangible and you make it interesting.
Yeah.
I think if I could just add to that, I think it's helpful to give them real world examples. So many people think, well, it wouldn't happen here. Nobody's going to pay any attention to us. It happens whether you're a large, medium, or small organization. And I think when they realize what the ramifications can be, they might be going back to using paper and pens because their systems are down. Yeah. That this is really happening to real organizations, and everybody needs to be, cognizant of this and recognizing that everybody's responsible for cybersecurity.
Right. One of the things that I tell people is, treat patient health information the way that you want your patient health information treated.
Good point.
It's it's a golden rule in effect.
Yeah, Stephen, I think I couldn't say it any better than that.
Mm-hmm.
That hits home. A couple other questions that are coming in. I think two of them that are relevant real quick, if we could just answer. Keith, we talked about split tunneling. Both Ashley and Deborah asked to kind of explain a little bit more specifically what that means and who initiates that. Is that the user or is that a policy that's placed by the network administration team?
Yeah, good question. So that you are surfing the internet and then you decide that you want to log in remotely and get some work done. So if you've got some VPN software client on your computer and you use that to connect to your company's internal network, during the time that session is active, your computer is blocked from surfing any other websites. So it really literally cuts you off from the internet except for the connection that you have into your company network. Once you terminate your VPN session, then you're free to surf the internet. That's typically a control that IT puts in place when they set up your VPN software to allow you to connect into your company network.
Yeah. Thanks, Keith. And then Sandra has a very good question here, I think, which is very relevant. How much do you anticipate is budgeted yearly for cyber attacks, and does risk management dollars allocated equal liabilities? So I think maybe from Stephen or Chris's perspective, did you want to weigh in on that from your experience?
Well, Stephen and I have a shared experience on that one on a former employer of Stephen's and my current thing. But generally, what I've seen in healthcare is the amount of money budgeted for information security, for protecting against cyber attacks, responding to cyber attacks is inadequate. There's more of a focus on profit. So we joked a number of years ago about the fact that if a board of directors for a hospital, they have a choice to make. They can spend more on security or they can buy the MRI and make money. They're going to buy the MRI and they're going to make money. Mm-hmm. Now, there's been progress made over the last 10 years, but still the amount of funding that's available within a healthcare organization to adequately secure the organization is in a lot of cases woefully inadequate.
And I'll just say it is overwhelming to organizations because it's a very specialized field in a lot of respects, and the cost associated with it is it's high. Let's not mince words. It's not inexpensive to maintain a above par security posture in terms of people, processes, and technology. So unfortunately, some organizations, they might not say that, but there's a risk factor involved, right? And they're going to weigh the pros and cons and roll the dice, take your chances.
And Teresa, from your perspective, any thoughts from what you've observed from the government perspective?
Well, and I think Stephen's spot on. It's all about risk. And I think that's something that senior management understands because they see risk in all areas, whether it's finance, patient care, whatever it is, they understand risk. And when you can put it into terms that they understand, and particularly being able to use so many examples, unfortunately, that we have now of healthcare organizations being attacked, I think it helps them to understand that it's money well spent it's an investment, it's not an expense, and that if they're hit with some form of ransomware, I mean, it can bring the organization to its knees, and then it's going to be extraordinarily expensive to do the remediation. You might have to pay the ransom, whatever. So it's make it real and make it, help them to understand it from a risk perspective.
Yeah, and I think that actually kind of brings us into the next phase of the conversation, which is around risk management, right? And so, Teresa, from your perspective too, what do you need to do? What do organizations need to do initially around risk analysis and risk mitigation when they first approach that topic?
Well, I think they need to work with their colleagues in the organization, whether it's legal risk management and others, and really try to hone in on having a discussion about, what are the most important, what's the most important systems, data, et cetera, that needs to be protected, because you only have so much money within any organization. You cannot protect everything to the highest level. So you need to focus on where are the dollars best spent, and identifying those areas of risk is absolutely critical as a starting point. And then you can begin to understand, exactly what budget you have available, resources, et cetera.
Yeah, thanks, Teresa. And any of the other panelists, any thoughts around initially assessing risk and conducting risk analysis and risk mitigation?
It, to me, is the foundation of your information security program. You need to do it. There's a regulatory requirement to do it, but there's also just a good practical, you want a sound security program, you need to assess your risk. And that's not you got the report, it tells you what your risks are and recommendations, that you also have to act on that. And you have to implement an ongoing risk management program so that you're looking at risk as it comes up. It's sort of like what you mentioned at the beginning, Scott, of the announcement that have come out of the federal government about the SolarWinds attack, about the ransomware attacks on hospitals, that kind of thing, is you have to have an ongoing mechanism to look at where you're going as an organization and what's coming up.
Yeah, and Chris, so what do you think is in your experience, what do you think is an acceptable level of risk as it relates to preventative security measures, and what do you seen most organizations accept?
I think what I've seen is in some cases there's not an acceptance of risk. It's more of a, oh yeah, we did our little exercise, we did our risk assessment, we got the report, we'll put it on the shelf, we're not going to deal with it. And we've dealt with clients who say 10 years ago, that's basically all they did. They're getting more and more savvy because they're seeing the actual hits on their organization. They're seeing what they, how it becomes an investment. So I think that's one of the things that's something that folks need to learn out there if they're in a senior management position or they're the CISO or whatever, is they need to learn how to assess risk instead of just looking at it and going, oh, okay, well, we got something over here. We might do something, we may not.
I appreciate that. And so there's a couple questions that are coming in from the Q&A that I think are relevant, but I'm going to answer them a little bit later down the presentation, specifically around ransom and paying ransom. I think we have a section dedicated specifically for that. But if we want to just kind of stay focused on the risk assessment piece here, we chatted the other day about risk assessment tools. What are some recommendations from the panel on what best way to take risk assessment tools and be able to use those as they assess risk for their organization? And Chris, we had some thoughts on that earlier.
Yeah. For smaller organizations, there's a tool out there that's provided by the federal government for the Office of the National Coordinator for Health Information Technology, or ONC. And it's a web-based tool that the nice thing is it's free. The downside of that is if you're not really familiar with the lingo of IT and things like that, it gets into garbage in, garbage out. You need to have an understanding in order to use that tool. And the same is true with a lot of the tools I've seen on the market, is there has to be some knowledge up front, because there is no tool, as far as I'm concerned, that's an out-of-the-box tool to assess risk. There needs to be a level of understanding. There are a number of good tools out there on the market to help out in that space, but a lot of organizations, they'll subscribe to it or buy it, and the results that they get out really don't work well at assessing their own risk and mitigating that risk.
Right. Keith, any thoughts?
Yeah, I'll jump in here as well. One of the things organizations need to be careful of is understanding what a risk analysis really means. We've seen cases where an organization downloads the Office for Civil Rights HIPAA audit protocol, which is really a checklist to see if you're compliant with HIPAA by having you do a self-examination of your documentation. A risk analysis really looks at threats, vulnerabilities, controls, puts a risk score to it. None of those features or components are really part of a compliance checklist. So you don't want to make an error of thinking you're doing a risk analysis when you're really just checking some boxes about whether you've got documentation or not.
Right.
Yeah, and I think last question here, specifically talking about organizations at risk analysis. This question here, before we go to a couple of the live Q&As that are coming in here, what are some steps organizations can take to limit risk? So we've spoken about providing staff with ongoing training. We talked about a technical risk mitigation of split tunneling. What else from the panel's perspective is ways in which they can limit risk? Keith, I'll pass it back over to you first.
Well, in information security, we call it basic blocking and tackling. It's making sure that your systems are getting patched if there are weaknesses in operating systems or applications. Any kind of preventative tools that you can put in place, web filtering, email filtering, antivirus on workstations, these are all basic things. Encryption, we still see reports of breaches that happen in healthcare because somebody lost a laptop where it was stolen and it wasn't encrypted, and the fines are pretty significant. So even just doing the basics is what people should be starting with.
Yeah, and Stephen.
To that, I was just going to piggyback on that is CIS Top 20, formerly known as the SANS Top 20, and that's a free tool. It's not even a tool, and it breaks it down into the basics. Just if you do these 5, you're getting yourself, a good baseline. So I also recommend that as well.
Yeah, I like CIS because it's simple, it's straight to the point, and it's very in the 20.
Yep.
You could show that to your administration right there, and it'll be easily understood.
Yep.
Chris, any thoughts from your perspective? In addition,
Who is that directed to?
Oh, Chris, I'm sorry. Yeah, any other thoughts from that, or?
It's looking at it from also getting back to what I would call the basics of, you have policies and procedures that are accurate, that people can follow, that are accessible, versus something we have one client who had first 3 pages of their policy were definitions. So you got an employee who's trying to read that, they're going to lose interest rather quickly. So you make things that are accessible to them, because that is part of training, is an education using policies and procedures. It's doing audits periodically. If you have an intrusion prevention or intrusion detection system, it's looking at the alerts that are coming out of that on a regular basis. So that's what I look at, is in addition to what Keith and Stephen have mentioned, it's looking at it from the perspective of what can I do, especially if you're looking at it from a dollars and cents standpoint, is start off with what can I do that's not really going to cost me any money, or not going to cost me a lot of money, and you can accomplish a fair amount if you look at that, and it's sort of the low-hanging fruit type of a analogy.
Okay, so there's some good questions coming in here around incident response. I think that we can maybe pivot the conversation now to incident response specifically. There's a couple questions. We've mentioned ransomware before. We had a couple questions come in. I think we'd like to address those now. Teresa, I'm going to pass this one to you since it involves notification to the FBI. Even though you're not in the FBI, but obviously DHS is closely partnered with the FBI. When your facility is held for ransom, do you have to notify the FBI, or do you recommend notifying the FBI under a ransomware attack?
I would absolutely, no matter how large or small your organization is, to contact the FBI should be on the top of your list of folks to contact, as well as CISA, whoever your representative is in your area. the FBI is going to come in. They're not going to put hands on keyboards and help you restore your systems, but they do want to do a follow-up to find out, is this some kind of a new strain of virus or malware or whatever. So it's really important for them to be involved, and they may need to follow up with legal action. That's really what they're looking for. From a CISA perspective, we realize that this is dynamic. There are, as I said, new strains of malware that are coming out, it seems like every other minute. So it's important for us to, if you can share that information with us, we can do an analysis of it, give you some recommendations on how you can follow up. But we also want to be advised of this as soon as possible, so that as part of our analysis, it may mean that we need to follow up with a vendor and tell them they need to develop a patch. It may mean that we send out a national alert, so we give everybody a heads up and they can start to be proactive. So sharing that information, because we all want to know as quickly as possible so we can take action. And from a national level, we can help to facilitate that. So I would highly encourage folks to, as I said, contact the FBI and to contact CISA.
And this kind of leads into the next question, which I wanted to bundle both of these here together. This is the question of the hour. What is the panel's guidance concerning paying the ransom to retrieve their data? So everyone has different perspectives, and what you've seen has worked and what hasn't worked. I'll start, I guess, Stephen, from your perspective. What are your thoughts on that?
That's a tough one. I'm inclined not to pay it if you have a good backup and you can restore the data. But that's something I think you really need to engage legal at that point to make that determination. And part of that assessment determination is going to be exactly how bad things are. Did they grab one system? Did they grab everything? Is your entire Active Directory infrastructure compromised at that point or locked out? Or are you dealing with one system that you can you can work around?
Chris, what are your thoughts?
I know that what I've seen in the media about what the FBI's position is, don't pay the ransom. I do think that, and I think as Stephen was mentioning, that it's not necessarily that cut and dry. You need to assess the situation, and there are going to be situations where, from just a strictly business perspective, or in this particular industry, healthcare perspective, you're going to say, yeah, I'm going to pay it because of the significant impact to my organization and to patients out there. Mm-hmm. So it's going to depend. I would advise the initial position would be not pay the ransom, but while you're in that position, take a look at the whole picture. As Stephen mentioned, backups. Do you have backups that you can rely on? What did this do to the whole system? I mean, you have the example of what happened in Vermont with the University of Vermont Health Network, where the governor actually called in the National Guard cybersecurity experts to help the University of Vermont recover. And I don't know if they paid the ransom or not, but that's an example of something where it's really significant as far as an impact on the organization and the impact on the patients that system serves.
Keith?
I have two comments to make about it. I think you have to take it on a case-by-case basis, like Stephen and Chris said. We're seeing a trend where a lot of organizations have been able to successfully recover from a ransomware attack because they had backups in place. Now the criminals are engineering so that they're stealing data first, and then they're encrypting it with ransomware. And then the threat becomes, well, if you don't pay the ransom, we're going to publish the stolen data out on the internet. So they've changed the game in that regard. So, how you approach that is maybe changing as well. Secondly, back in October, the U.S. Treasury Department's Office for Foreign Asset Control published an advisory stating that any U.S.-based companies that pay ransom to individuals or entities that are on a do not do commerce business with, you could be fined by the government because you're essentially funding what they consider to be terrorist organizations. So that's a new wrinkle to be concerned about as well.
Yeah, Keith, and I can kind of piggyback on that as well too. I think, and obviously Teresa, jump in here with any thoughts, but I think in my experience as well, a lot of those ransoms, I mean, you're alleviating the pain initially, But you have to also consider where's that money going and what is that money funding in the back end as well too. And a lot of these activities are ways in which terrorist organizations can finance their capabilities to project power where they shouldn't be. So we've seen that as well too. Teresa, your perspective on that?
Well, like my fellow panelists, certainly from a federal perspective, we would advise not paying. It just encourages bad behavior by bad actors. And the more successful they are and the more money they make, that's why they do it. So, however, we recognize that it is up to the organization to make the final decision. And there, as has been mentioned, a number of factors that go into that. Also recognizing that bad actors, as Keith mentioned, can hold you for ransom because they've taken your data and they may publish it. So you need to take that into consideration, and that could be huge, especially when you're talking about a hospital that has other ramifications that need to be considered. So we certainly understand that. And also, of course, if you have cyber liability insurance, your insurance carrier is going to weigh in on this. And in some circumstances, they have decided that they will pay. And because sometimes they may feel that if they actually trust the bad actors to give them the keys to restore the encrypted systems, et cetera, that it's cheaper to do that than to go through the whole remediation process. So there are so many factors that need to be considered, and we certainly understand that.
And we have a lot of good questions coming in here. If we don't get to answer them live, we will attempt to answer them for you, if not during the webinar, but after as well too. I want to focus now a little bit more on incident response, since the topic's been on the top of mind here. Barbara asked the question is, what is the recommended communication plan that should be followed when employees believe that they have witnessed a cyber attack? So I think I'll open that first to Stephen to see what your thoughts are on that.
Number one, obviously, is take it seriously and gather as much information as possible. Check your firewall logs immediately. Look for any holes. Seal the holes immediately. So you want to isolate your network at that point to prevent any further exfiltration of data or potential enabling of ransomware that's been embedded in some system. And just waiting to be triggered on. So I think first step is take it seriously, check your firewall logs, harden it immediately, and then assess the damage at that point.
Yeah, and I think it's important to have an incident response plan that's put in place. And Keith, you spoke the other day about this as well too. Who do you think are some of the key stakeholders within the organization that should be part of the incident response plan?
Yeah, that's a great question. Outside of information security and IT, you need to have legal involved, compliance, privacy. There's also a public relations and marketing aspect to this, and also human resources, because people need to be reminded about social media policy, and they shouldn't be going out on social media networks and talking about the incident that's going on. So these are all different facets of business units that need to be part of the response plan. And these are people that you should be inviting to your tabletop exercise if you're doing such things, because it builds those relationships and expectations. And it's a great way for the technical folks and the non-technical folks to start to understand each other's worlds.
Yeah, and I think that out of all those individuals, I think the one that is the least thought of, that's probably one of the most important, is general counsel or legal counsel, because as Keith, as we had talked about before, that establishes attorney-client privileges and really provides you with protections down the road of data being discovered by courts. It's going to take some kind of action against your organization down the road. So, Chris, from your perspective, any other thoughts around communication, incident response, and in whether it be internal communication or external communication?
Well, to me, I mean, it looks down to, you got to have the plan, you got to have a team, but you also have to, this gets back to the training piece, you also have to inform all of your staff, it's sort of the old see something, say something, is that if I'm an employee and I see something, I need to report that, and I need to report that immediately and not wait. Now, when you're actually in a response scenario and your incident response team has been activated, one of the things I recommend is you think about it in a least privileged fashion. because you don't want a lot of folks outside of the core group to know what's going on initially, so you can do your investigation and figure out how big is this, what is the impact, what are the things that we need to do. So you've got a core team, they look at it, they say, okay, well, now we need to involve legal, now we need to involve law enforcement, now we need to involve marketing. But initially, it's a small group making that decision as to whether or not this is a big deal, because sometimes they'll get together and they'll find out, well, we suspected it, there really wasn't anything going on. But if that gets out, now you have a potential bad headline saying, hey, they had a breach or they had an attack, when after you do the investigation, you find out that wasn't the case.
Yeah.
I do want to circle back to what Keith and Chris said. I think controlling the message is vital. It's really important, and that's part of the user training or the employee training. Is that in the event of an incident, refrain from making comments on social media. If people come up to you and say they're a reporter with such and such, refer them to the designated people in the organization that can speak on behalf of the organization, and just make sure that every employee knows who that person is. Say, oh, I'm sorry, feel free to speak to this person. They have, they can provide the information you're looking for.
Hey, Scott, one other thing I want to add. This is another one of those valuable takeaway tips. One of the parts of a hospital's organization that most often gets overlooked is the foundation. These are the people that go out and try to solicit donations from patients. Well, imagine adding insult to injury if you're a patient whose record was compromised in a breach, and then the foundation has no knowledge of that, and then they get a phone call asking for money. So you want to make sure that part of your protocols include letting folks in the foundation know, so that you can avoid that faux pas.
Absolutely, Keith. Thanks for sharing that. And
Scott, if I could.
I was getting ready.
I think, and this has been mentioned, that it's absolutely essential to have a cyber incident response plan, and it's not just having the plan. I mean, you actually need to exercise it on a regular basis. Every single time you do that, you're going to learn something, and you're going to be able to enhance your plan. And it helps folks to be prepared so that if something actually does happen, they're not just like, uh-oh, I know we have a plan, I don't know where it is, I don't know what I'm supposed to do. So having that training, as has been mentioned, is really critical. And as part of that, and Chris mentioned this, you need to know when it goes from just an event to an incident to a significant incident, who needs to be involved, what that looks like as it moves up the hierarchy. And I would suggest that when you have your tabletop exercises, if you do have cyber liability insurance, involve your external legal counsel. I know I've done that when I've been in other organizations, and they can be a wealth of information because they deal with clients who have had breaches on an ongoing basis. That's their job. I know I had never been in a major breach, so this was really, really helpful to have their guidance about what we should do, when we should do it, who we should talk to, et cetera. So I think that folks might find that extremely valuable.
Yeah, and Teresa, another question as well too, I think that you're most apt to be able to answer is, so the organization's looking at their incident response plan, or maybe they want to do a tabletop exercise. Could they potentially ask for a U.S. government resource to participate in that? And if so, how do you coordinate that request?
No, that's a great question. Thank you. We have a number of options. We have what we call tabletop in a box exercises, which is a situation manual that you can conform to whatever type of tabletops that you want to know. Right now, we have one on ransomware, and we're developing a couple of others. We also have, excuse me, folks at the regional level who are experts in training and exercises that can help you to plan and facilitate your exercise, as well as we have resources at the headquarters level. All of these are at no charge. So if anybody's interested, please go through Scott or contact me directly, and I would be delighted. We want folks to be resilient. We want them to have plans. We want them to exercise them. So happy to help. Thank you.
And since we're on the topic of incident response planning and exercising the plan, Sandra just asked a good question here. Should it be performed 2 or 4 times a year? What's the recommended frequency of that plan? Chris or Stephen?
I would argue quarterly, because the landscape continues to change, and any organization is constantly introducing new systems into their environment, and those have to be factored in. So I think quarterly is preferable in my opinion.
Yeah, Chris or Keith?
I agree with Stephen. Quarterly is a good regime. The only thing I would add to that is if your incident response team changes, you have new key players in it. It's a good idea to do an exercise if, say, you did your quarterly test a month ago, but now you have a significant change in the team. It's a good idea to get the team together so that the new person who's coming onto the team has an understanding of what the plan is, where is the plan, who do we need to contact, all of that. So it's more dynamic.
Okay, so good question. One other question on the ransomware topic, and then I want to flip over to preventative, or excuse me, not preventative, but recovery capabilities here. These are all questions that are coming in. Moses asked the question, there's a concern that the EMRs, or the electronic medical records, will not be recovered 100% post ransomware attack. And what is the panel's thoughts on this? I'll kick it off with Stephen, your thought first.
I think that's it's an interesting thought. I say that the conversation that you need to have with your EMR provider and get their understanding of how they approach data integrity and restoration in the event of ransomware, things like that. So I think that's a good conversation piece for your vendor of choice, actually.
Yeah. Keith or Chris, any thoughts?
I think that it also gets back to, if, say, you have an on-premises EHR versus using a software as a service vendor, it's looking at, have you segmented your network? Do you have backups that you can recover from? It's all part of disaster recovery planning, business continuity planning, because you're looking at it and saying, okay, what can we afford to lose? Because it is true, you're not necessarily going to get back everything, because if you do your backup at 8 a.m. and 6 p.m. and something happens in the middle of the day, you're going to lose part of that. But I think if you take the steps to make sure that you've got valid backup that you can actually recover, and that is, as Stephen pointed out, is working with your vendor in addition to that, I think you're better off.
So another question that came in here from Armando. What is the likelihood of cyber attacks to offshore American companies that manage health information systems, specifically about risk on non-incorporated territories like Puerto Rico? And are there any concerns or vulnerabilities associated with that? So I'll open that up to the panel if anybody has thoughts on answering that.
Yeah, I would say that situation is something that you should have been thinking about at the time you were evaluating a vendor's products and services. Ask the question, are any of these products or services offshore? And if so, dig a little bit deeper into what does that mean? There are some companies that we work with that have policies that don't permit of operational risk because there are a lot of unknowns out there, especially if you'd start to dig into it and you find out that offshore company is subcontracting to other parties to help them provide those services or products. So there's a big can of worms there that you need to try to open up before you sign a contract.
Right.
And I think that's where every organization should have a security questionnaire, security assessment questionnaire that they can provide to those potential vendors, answer the questions and really look at the answers, and just don't skim through it, really. And ask follow-up questions. That's on you, I think, at that point.
Yeah, and one of the questions that comes up is, I've heard this a number of times over the years, is, does HIPAA allow me to use an offshore vendor? The answer to that question is yes. But I mean, as Keith and Stephen have both indicated, you also need to look at what is the risk of that vendor, what country are they in, what are the laws of the country, what kind of security do they have in place, what are the downstream vendors doing? So and I agree with Keith too, as I've seen a lot of contracts, it's specifically put in either an MSA or a business associate agreement where it says you cannot offshore our data. It has to be all done within the United States. And a lot of times, is that a regulatory requirement? No, it's more of a risk requirement.
One other thing I'll throw in here quickly. It's been my experience that if you provide a vendor with a questionnaire before you've signed a contract, they'll fill out anything you give them because they want your business. Not so much after the fact. So take advantage of that opportunity before you sign a deal.
No, that's a good observation, Keith. Absolutely. So let's focus a little bit now on recovery. So Karen has a good question here, and I concur with her. It seems like from her observation was lots of focus on preventing cybersecurity risks. She says that since it seems like cyber criminals are always a step ahead, should healthcare providers be investing in cybersecurity recovery tools and solutions as well? Could we elaborate a little bit more on that? I guess, Chris, from your perspective.
I think you need to look at it from the perspective of size, first of all. One of the things that I think that I work with a number of smaller organizations, smaller practices where they're using a managed services provider. And so it would be, first of all, investigating what they're doing for you when it comes to cyber protections. Because again, if it's not in the contract with them, they're not doing it for you. I think that it is a good idea to look at not only tools to help you recover, but tools that you can use to mitigate faster, like investing in solid backup tools, investing in detection tools like intrusion detection systems or security incident and event management solutions. Because to me, if you can put more on the prevention side and you've got yourself set up with good disaster recovery planning and all of that, then you're far less, it's far less costly than an after the fact, oh, I just thought about it now I've got to pay for that expensive forensic person. Now I have to replace all these computers. I'm out of business for a certain period of time. So I would say prevention is a good place to invest.
I want to come at this from a slightly different perspective. We've talked about incident response plans, and I think that you need to have provisions in there in your plans on the recovery side. There are 4 or 5 things that I've seen as gotchas that really need to be part of an incident response plan. For example, in the whole recovery phase, you should know whether or not your cyber insurance policy requires that you notify your carrier or broker at a certain point when the event starts to unfold, because there may be some limitations on what they're going to cover if you aren't mindful of that. Secondly, as part of your recovery and maybe even into the earlier parts of the analysis, IT people like to drill into problems, and there needs to be some protocols established that work you towards recovery, where escalation needs to happen at a certain point in time, and those people need to be trained about how quickly they're trying to fix problems that they're seeing, because they might be stepping on evidence that you might need for your investigation. As part of the response, you may need to pull a third party in to help you. Do you have a third party lined up? Do they charge different for evening hours or weekend hours? And then another really big thing that you have to be careful of is, let's say that you bring in a third-party forensic vendor. Your focus at the time is fixing this issue, and you're not thinking about the invoices that are going to come 30 days later. So when you're having all of these conference calls with the vendors, you want to take very rigorous notes about who was on the call, when the call started, when the call ended, so that you have a way to reconcile those invoices when those start coming in. And then lastly, this is a key piece that people miss in the recovery phase, is you have to think about any staffing that you have to augment in order to catch up on the backlog of data when you've gone to maybe manual downtime procedures. And one of the things that can extend the recovery period is, at the end of the business day, you usually run some sort of midnight processing that posts all of your transactions to the general ledger. And depending upon how long that process takes, you can't continue to catch up on your data backlog until midnight processing runs every day. So if you're down for 4 days or a week, that's going to add a significant amount of time These are all things that need to be in your recovery plan so that people are thinking of and addressing them appropriately.
Yeah, very well put, Keith. Any other thoughts before we proceed to the next question? We've got about 5 minutes left here in the panel. So
Scott, I would just say that it's really critical for your CISO or your IT director to work very closely with risk and legal and procurement to understand if you have cyber liability insurance, what exactly does that mean? What does it cover? People make assumptions because they think they have it and it's going to cover everything, and it can be, there's a lot of detail, the devil's in the detail, and you really need to understand what exactly it is that you're buying and what are you not getting. So that's just something folks really need to think about. It's not all the same. Every policy is not the same.
Yep. Yeah. There's another question in here that I think is a relevant question, which we have not discussed yet. Ashley asks, how do you see vulnerabilities regarding the use of personal devices, and how are they being addressed?
I've seen situations where it's like, oh yeah, go ahead, use your personal device for business. We're not going to do anything about it. I think what needs to happen, I mean, that's a big significant risk. It gets into things like making sure if you're going to allow folks to use their personal devices, that you've got a solid mobile device management solution in place to do things like make sure it's encrypted, make sure that you can either brick it or basically wipe it when it's lost or stolen. So it's making sure you've got that. And it gets back to the piece that I think all of us have been talking about, and that's education. So if you want to allow, excuse me, if you want to allow somebody to use their personal device, you need to train them, you need to have policies in place, you need to have a tool. And I always recommend having them sign a mobile device management agreement or a mobile device use agreement. So those are some of the things that I would suggest.
Yeah. Keith,
I would, obviously mobile device management is critical. And it's not just end user training, it's also the IT staff who uses that or administers that product. They need to be well versed on the product as well. And if you're not using mobile device management, you are setting yourself up for a breach, failure of the worst order. I knew an organization that didn't use mobile device management, so that if an employee employee that had access to their work email, if they were no longer with the company, that information was still on the phone, and there was no way to erase it. And you never want to be in that situation. Never.
And with our final minutes here, at the one more question we can squeeze in here, Ruby has a good question. I think this is kind of summarizing everything we talked about: how to recognize cyber attacks, how to initiate the incident response plan. There's personal devices versus corporate-owned devices. So Ruby notes that most hospital employees don't understand all of these associated risks, especially with the use of hospital computer equipment, let alone everything else that we just discussed. So the question is, how would you suggest getting a large employee base trained on these risks?
Well, you probably have already in place some form of ongoing training, like new hires and annual refresher, but it's also looking at it from the perspective of make it fun. There are a number of very fun posters and stickers and things like that out on the web that highlight the need for greater vigilance. So it's making it accessible to them. It's using things like staff meetings, newsletters, intranet pages to communicate with them on an ongoing basis in a way that engages them.
Yeah.
Yeah, along those lines, and by no means am I trying to pitch. There's a Jimmy Kimmel skit out there online. Look it up. Just type in probably Jimmy Kimmel password skit, and your guts were hurt from laughing so hard at that. And that is an example of a fun and relatable training tool that people can easily just say, oh yeah, that makes sense, I get it. Just go ahead and look it up. It's hysterical.
I'm glad you brought that up, because when we deliver cybersecurity training, we actually start off with that to grab everybody's attention.
Absolutely.
It's amazing to see what people think about passwords and password security. So
Mhm.
if you haven't seen it, it's a good 3 minutes of laugh there.
Mhm.
So we are at the top of the hour here. I think we've just touched on the conversation here. I think we could spend probably another 3 or 4 hours on this conversation. There's a lot of good questions that are coming in. We'll look to answer them. I'd like to thank Robin from AHIMA to organizing this for us. Keith, Teresa, Stephen, and Chris, really appreciate your time here today as well. If anybody has any questions or would like to follow up with any of the panelists on this call, we will be forwarding out there'll be a summary question once you finish up the Zoom session here, but their personal LinkedIn accounts will be posted on the site on any follow-up correspondence that we provide to you. So thank you everybody for attending here today, and wish everybody the best of luck, and enjoy your holidays as they approach.
Thank you.
Thank you.